simulcasting here. Have to set up both streams. Hello. Hello, hello, my friends. My name is Jill Osbourne. I am the president and founder of the Interstitial Cystitis Network. It is Sunday, March 22nd in this crazy ass year. We're here to do a support group meeting if anybody needs support today. Now, I just have to make sure I've set this up correctly. Running a wee bit late. Hello, Cher. Hi, Marianne. Hello, Barbara. Hello, Molly. Hello, Ruth. So I haven't eaten breakfast yet today. And it's 12:45. Hello, Morika. I don't know if I pronounced that correctly. Hi, Shirley. Hi, Gigi. Hi, Jennifer. Hello, Denise. It's nice to see you. All right. The hair got washed today. No curls. I don't know about you guys, but like I am, since we're on home quarantine, like I'm going to bed really late. Like last night, I didn't get to bed till 3 in the morning, or just sleep until 3 in the morning, and I'm getting up later. Denise says, waiting on Peora. So we're going to try to keep shipping as long as we can. Unfortunately, we got a text this morning that the woman who does a lot of our shipping, her husband is sick. He has a very low fever. 99 degrees and a little sore throat. So she's not going to be working for a few days. So we're going to try to get all of our orders out as best as we can. I cannot go up there. So now it is literally on my sister's shoulders. So we will cross our fingers and hope that she can do some shipping. She's been pretty ill with a liver thing going on. And so she's had to have her gallbladder removed. So, but in any case, crazy world, right, my friends? Right. Hello, Becky. Hi, Kathy. Hi, Gigi. Hi, Molly. Molly, seriously, Molly's working on lunch. Yep. Hi, Elise. So, I want to show you what I was working on yesterday. Okay, so let me just introduce myself for y'all who don't know me, and just know that we're really informal. This is a really informal support group meeting today. I mean, seriously, I'm wearing my onesie. that tells you that I'm in a very, very mellow mood right now. Very, very mellow mood. And here, hold on a sec. Let me just get my computer here functioning correctly. YouTube, you go down below. Facebook. Oh, wait. Oh, God. Come on, stop it. Come on, computer. Whew, okay. Okay, so for those of you, and let me take my gum out. Sorry. I get really bad dry mouth right now, and so I have to do that. I don't understand why I'm dealing with dry mouth right now, but I am. So let me introduce myself. My name is Jill Osbourne. I am the president and founder of the Interstitial Cystitis Network. I'm the longest serving IC support group leader in the United States at 27 years and counting. I am the national IC support group leader. I do support group meetings several times a month at this point in time. We did one last Wednesday. My 2 scheduled meetings, the first and the third Sunday, although I'm basically now almost trying to do almost every Sunday, as well as some drop-in meetings. My meetings are a little bit shorter than they used to be, only because I'm still recovering from oral surgery and I have 4 holes in my jaw right here, and it was hurting me yesterday just a little bit, 2 weeks after surgery. So I got to be pretty careful there. My purpose in doing these meetings is to make you so strong, so knowledgeable, so informed that no one can ever mess with you again. Ever. I don't want you so strong and empowered that if somebody has the audacity to say that IC is not real or it's all in your head, you're going to be able to kick them in the butt and give them the information they need to understand that this is in fact a real condition. And I want you to remember too that we really no longer think of IC as an incurable bladder disease. We don't. We think of IC more. It's not. We think of more. We around the world now, all the top IC doctors think of IC instead as a pelvic pain syndrome, or according to the National Institutes of Health, the urologic chronic pelvic pain syndrome. Here, hold on a sec. Everything okay?
On the table, Jim.
What?
On the table.
I know, I had to start my meeting. So save my dad made homemade biscuits. I might, what I should go get one to show you my dad's biscuits because he makes wicked biscuits. Pretty damn good for a 97-year-old. And you know what? I'm going to swear today. I'm just warning you in advance. It is a time. It is a time for swearing. I'm sorry, but I just got to get it out. The stress is real. Um, so we no longer think of interstitial cystitis as a incurable bladder disease. We think of it as a chronic pelvic pain syndrome. Why? Because there are structures outside of the bladder that are usually also involved. And how do you see that diversity? You see it, and this is so incredibly important now with so many people at home and cruising social networking. When you drop into a support group and you see somebody talking about IC and they say, hey, this worked for me and that worked for her, or IC is all bacterial, or IC's this, or IC's that. You got to understand that there is tremendous diversity in this patient population. And we see it, number one, in what your bladder looks like, because some people have bladder walls that are bloody. They got big bleeding wounds in their bladder called Hunner's lesions. And, let me get pictures. Hold on. Let's see here. Let me see if I can grab a quick picture for you. Yeah, here we go. All right. So some of you have Hunner's lesions. So this is a picture. Actually, turn it upside down. This is a picture of 16 different bladders with Hunner's lesions. And I want you to look at this picture right here. This is probably the best picture. So you look, there's a center. It's almost like a meteor at the bladder. There's a center cavity or a center lesion. And then there are arms extending of redness around that lesion, right? So about 5 to 10% of patients have lesions. But some of you instead have a bladder that looks like this. Now look, that's very different than this, isn't it? So let's look at a lesion. Oh my God, why do I keep holding it? Okay, so look, you can see a lesion, big giant red hole, as compared to little tiny dots. So what the hell are the little tiny dots? The little tiny dots are what we call petechial hemorrhages or glomerations. So these are basically the equivalent of little wounds, little tiny wounds. Think of a skin knee. If you ever skin your knee, if you fell and skinned your knee, you'd have a lot of little tiny wounds in there. That's kind of what petechial hemorrhages and glomerations are. And many of you, myself included, have completely normal bladders. You look at my bladder, it's perfect. Looks like a baby's butt. It's so perfect on the inside. There's just no spots on it at all. It's a nice, pink, healthy bladder. And a lot of you have had cystoscopies or dissensions with cystoscopies, and they've told you your bladder's normal, right? So what the hell's going on if your bladder's normal? Well, again, this is a diversity. When you look at patients' symptoms, you also see diversity. Some patients live with terrible pain. Others have absolutely no pain. They just have frequency urgency. Do they both have the same thing? No. And when you spend time with patients and doing support group meetings like I've done for many, many years, that's when you really see the diversity in the patient stories of how their symptoms began. Because for some people, IC begins in childhood, while for others, IC begins after menopause. Are they the same? No, absolutely not. For some people, IC begins after having a baby, while for others, IC begins because you've had a terrible diet and you've only drunk soda or coffee for a decade. Not understanding that the bladder, the bladder's pretty mighty in terms of being able to defend itself against chemicals, but not to that degree. You pour acid on the bladder every day, the bladder wall's going to start to break down eventually. If I poured sulfuric acid on my hand, what's going to happen to my hand? It's going to turn red and there's going to be a bubble on it. Now granted sulfuric acid is extremely extreme, but let's use a different example. Let's use citric acid, a concentrated citric acid that you would find in Coke. Okay. So if I poured soda every day here and many, many times a day, because some of you drink some used to drink 8 or 9 sodas a day, eventually this area is going to start to feel the skin's going to change, skin's going to get drier. Then you're going to start seeing some redness. Then you might even see a wound develop over time. Now, of course, that's a very simplified explanation in terms of uh, you know, how prolonged acid can make a difference. You just have to remember, too, that when we consider evolution and we go back 5,000 years, because remember, our bodies were built 5,000 years ago. Evolutionary adaptation happens in a 5,000 year period. What were our ancestors exposed to back then? Did they have acid every day? Oh, hell no. The only time they had acid was when they were eating unripe fruit or fruit that wasn't quite fully ripened, and that was only seasonal. So they didn't eat acid every day. The only people that maybe were exposed to acid every day were people who grew up around the equator, where your ancestry might be in the equator area. Then you would have had more fruit throughout the year. I am blessed to be a Norwegian and Swede. And my family comes from the Arctic Circle. So did we have acid exposure? Oh, hell no. The only time we had acid exposure was around berries. So we can argue from an evolutionary standpoint that perhaps my body has not developed hadn't had the time to develop defenses against a lot of acid as compared to somebody who grew up around the equator and you've had high levels of acids for tens of thousands of years, where in northern Norway we might have had high levels of acid maybe for the last 800 years or 600 years, when coffee and trade happened. So it is really crystal clear that there's tremendous diversity. Now, the real question then is, what are the variants of IC? Well, this is what all the doctors and the international researchers around the world have been studying for the last 10 years rather. There's this kind of competition to see who is going to develop the perfect subtyping system. And in Europe, they use 16 variants of IC. In Canada, they use a system that focuses on 6. In the United States, we don't have a nationally agreed upon system, and there's some resistance to doing subtyping. However, I use a system that was created by Dr. Christopher Payne. And he ran the IC research program at Stanford University, and he did it. He introduced his subtyping system about 5 years ago. And mind you, I think it's brilliant. I think it works really, really well. So anybody who calls me for coaching, we always go through subtypes and we try to subtype them. When he introduced his subtyping system, he was very provocative. He said, "Hey, we should treat IC patients like cancer patients." Now, in my brain, I'm going, oh, hell no. Why would you even say cancer and scare people? There's no relationship between IC and cancer. And his answer to that is, yeah. Read the article. Jill, you didn't read the article. What he says is that when someone is diagnosed with cancer, they don't just say you have cancer and send you on your way. They give you a very specific, nuanced diagnosis. They say you've got cancer of the left breast that is estrogen dependent, type 1, 2, 3. And based upon that very clear diagnosis, you and your doctor are able to have a really good discussion about treatments, and you have a very clear, intuitive treatment pathway, correct? Or for me, 3 years ago, complex endometrial hyperplasia with atypia and a vague architectural complex. What was that? Early uterine cancer. And based upon that diagnosis, we knew exactly what to do to save my life. And that was to have a hysterectomy, which I did. That's a whole nother story. But specificity matters. You know what to do next. And so in his proposal for his subtyping system, he said, here's the problem. You get diagnosed with interstitial cystitis, but you don't know what the hell to do next. There's no clear intuitive pathway. Even your doctor, so many doctors don't know what to do next, right? You're kind of, you're sent, you're told, okay, you got IC, go home and read about it on the web. And most doctors will send you to our website. But ultimately, you really don't know what to do next. And your doctor might be whipping out a textbook. It might be giving you Elmeron, might be giving you Elavil, might be giving you a bladder instill. But even then, there's a lot of guessing going on. And frankly, you deserve more than a guess. You need a clear uh, understanding of your pelvic anatomy. I always tell patients you are an anatomical mystery to be solved, right? And when you go to the doctor, you never, ever, ever walk in and say, you've got interstitial cystitis. In my opinion, you don't do that. You walk in prepared to talk about your symptoms because you need your doctor to study your body. We need to study your body, figure out what the hell's going on. Now, understand too that let's just talk about the pelvis for a moment. So think about the pelvis for a moment, hip bone to hip bone. What is it? It's maybe what, 6 inches tall? Maybe, in terms of the bony structures, maybe 5 inches deep, maybe as wide as your hip bones. Here you got this small confined area. And in this small confined area, what do you have? You've got organs. So you got your bladder. You've got for women, you got your uterus. You've got your vagina. You've got your bowel. For men, you've got your prostate and all that sort of stuff. So we know that there are organs in the pelvis. We also know that the pelvis is kind of the super highway that blood vessels and nerves. So the blood vessels from your heart, all that are supporting your legs, end up going directly through your pelvis and down to your legs. And we know that the nerves for your legs and the nerves for your pelvic structures, your skin, your vulva, your clitoris, your prostate, all that sort of stuff, they all go from the spinal cord right down into the pelvis and right through that pelvic cavity. And then, of course, we have muscles. The other thing you've got to understand about the pelvis is that it is the buffer between the upper and the lower body. So it carries the weight of the torso. And so think about it this way. Well, why do people who are extremely overweight have more bladder problems? In many cases, because they're carrying so much extra weight, it's straining muscles. The pelvis will also defers or deflects pressure from weight being pushed up your legs when you walk. I forget the exact term for that. It's a physical term, right? It's physics. And so if you were to stumble, and you sit hard on one foot, that pressure or that stress gets directly reflected up into your pelvis through your leg. We also know that if you have one leg longer than the other, that also is going to create some long-term chronic muscle dysfunction. So why are muscles important? Because the muscles of your legs attach into your pelvic cavity. They attach to your sit bones and your various bones in there, just like the muscles of your torso, your core, or your back muscles, like your psoas muscles, all go deep into the pelvic cavity. So, we now pretty much understand that one of the flaws in working with pelvic pain is that doctors in medical school are not taught the relationships and how, for example, organs can change muscles. We call that a viscerosomatic reflex. So, if, for example, your bladder's screaming in pain because you're going through chemotherapy, because chemotherapy really hurts, that pain is going to trigger your spinal cord and your brain to tell your muscles to get tight to protect you. We call that a guarding reflex. So we know that an organ can change a muscle. But we also now know that a muscle can change an organ. We now know that if you have long-term chronic muscle issues, that muscle tension, muscle pain, muscle dysfunction, muscles so tight they're restricting blood flow, muscles so tight that they're squeezing nerves, that also is going to affect the bladder and give you frequency urgency. And pain. If you've got tight urinary urethral diaphragm muscles, you're going to have frequency urgency. If you've got tight levator ani muscles, you might have rectal pain or bladder pain. And we also know that tight muscles can, through a very complex process of neurological dysfunction, can trigger a breakdown of the bladder wall. A nerve that's super irritated releases substances that cause the tissue to break down, something called substance P. So let's go back to this picture for a moment. I think the assumption here is when you think about a bladder injury, you're thinking it's coming from the outside in, like an outside chemical exposure, like chemotherapy. But I remember when I think it was Dr. Theo Harides gave a lecture on our website like 20 years ago. He said, Jill, you cannot underestimate an internal process also causing the bladder wall to break down. And that's what he's referring to, this intense neurological inflammation from tight muscles that are basically damaging nerves. And so let's go back to this picture for a moment. So again, this could be abrasion, chemical abrasion of some type. So when we think of Hunner's lesions, we now have a clue about Hunner's lesions, right? We now understand that Hunner's lesions for some people are actually viral infections, Epstein-Barr virus. In fact, I was working with a polyoma BK virus patient. Oh God, I got to tell you, it was such an interesting call. It was a call on Friday with patient. And so I don't remember how long she'd had symptoms for 5 years. And she wasn't really good. She wasn't describing her symptoms really clearly to me. It sounded more like frequency urgency. So we started talking about her history. She was a ballerina. I went into the whole discussion about what ballet does to the pelvic floor. Her symptoms started when she was doing ballet, at least early on. And, and so in my mind, as I'm talking to her, I'm going, okay, this is a subtype 3 pelvic floor dysfunction patient, right? And then she said, but when they did a hydrodistension, what they found was lesions. Now I want to get this right. I want to make sure that I'm telling the story right. No, take that back. They did not find lesions. What she had was blood in her urine, a lot of blood in her urine, a ton of blood in her urine. Like she was peeing pink urine and she would pass blood clots. And when she would wipe with the toilet paper, she would have a red smear. And her pain level, and this was fairly new. This had started 6 months ago, something like 6 months ago. And she had all the tests, the MRI, her kidneys were fine, and they looked at her bladder, and her bladder actually looked fine. Although remember, we kind of know that some doctors don't know really how to identify lesions correctly. What they couldn't explain is why was she bleeding? And so, she said that to me and I went, okay. So we call that hemorrhagic cystitis when the bladder is hemorrhaging. And she goes, yeah, my doctor said that. And I said, so what we have associated with hemorrhagic cystitis is a polyoma BK viral infection. That's what you'll see at the National Library of Medicine when you look at the research on hemorrhagic cystitis. We often see a viral infection. And she said, yeah, my doctor kind of mentioned that. And then I said, the other thing we have to think about is, could it be a fungal infection? And she goes, yeah, my doctor said that too. And I said, all right, have you had a next generation urine test? If you want to know, we want to know exactly what the hell's going on in your urine, you do a next generation urine test. And she's like, no, what's that? And I explained it to her and she ordered one on Friday. And so that's kind of proof of the diversity. Now, she had frequency urgency symptoms when she was doing ballet. And she had, what did she say? She had, I think she had, um, she might have also been a cheerleader and had a couple of really bad falls. And so, and of course, guys, I talked to a lot of patients, so I could be getting patients mixed up. I apologize for that, but it is what it is. Um, but there was definitely a history of pelvic trauma, long history of ballet. And so are her muscles healthy? Well, she didn't know. She never had a pelvic floor assessment. That was the other thing I told her to do. Let's get a pelvic floor assessment. Let's see what the hell's going on with your muscles and have a next generation test so we can get an answer once and for all to see if you have a fungal infection or a bladder infection. That's really, really interesting. So, again, diversity here, this tremendous diversity. And so your job as a patient now is to try to solve your unique mystery. And again, that's where social networking and so I see support groups fall far, far short because they forget to tell you that there's diversity and that you might read this horrifying story from one patient and go, oh my God, that's going to be me, when they have a completely different subtype. Your subtype might be that you fell on your tailbone and you've got a damaged tailbone and damaged levator muscles. Well, that, my friends, is curable. It's potentially curable. And that's what Dr. Payne argued when he presented his subtyping system is he said, it is incredibly unfair to tell patients that there is no cure when in fact, for some of these variations, there are cures, especially pelvic floor injury. All right. So anyway, when I do these support group meetings, I generally do a 30-minute like mini lecture, which I've just done. Then we take your questions, then we have a giveaway, couple of giveaways, and there you go. I think the meeting is probably going to last 2 hours today, just because again my mouth is so dry and I'm still healing, and so as soon as it starts to hurt, I'm going to stop. I want to show you what I was doing yesterday. Look, baby. I was making mass. And super, super easy. Literally takes, aside from cutting out the fabric, takes 10 minutes. If you're a sewer, it's so cool. And so if y'all want me to show you how to make a mask, I can do that. I made 5. There's the all blue one. And I've got fabric for a ton more. I could make hundreds. Little owls, night owl. And so I'm going to be giving, I'm probably, this is my first one, still my best one. I'm probably going to give these to my neighbors, or I might just pass them out at the grocery store. Although I don't really want to go to the grocery store, to be quite honest. But anyway, there are a lot of different mask patterns online. And if you're a sewer and you've got some extra quilting fabric, go for it. You can make a two-sided, this is two-sided cotton. I did not do the one with the packet for the filter because I don't have access to filters. And so I'm just making these. So these have a 50% likelihood. They're not like an N94 where that will filter out 97% of viruses. These will filter out about 50 to 60%. But still it's better than nothing. So this is like, guys, this is like World War II. I mean, this is unprecedented in my lifetime. I was born in 1960. And back in World War II, all the women got together and sewed bandages and all sorts of stuff like that. We're going to be doing that again. And, just understand that we are in very, very, very unprecedented times. I have a medical background. I have 3 degrees. And I will tell you that we're going to be in this for the long haul. And anything and everything that you can do to help the people around you and to be safe is great. It infuriates me when I saw pictures yesterday of people on the beach in Southern California and playing basketball. They have no freaking clue what's happening. Please follow my Twitter. ICN Jill is my Twitter handle because I post some really, really good videos and try to give you really accurate scientific information about this. I just want you to understand that this is not going to be short term. This is going to be long term. You're going to need to be protected for a longer period of time. I fully anticipate that a year from now, we're still probably going to be doing some we're not going to be doing big social gatherings. The holidays, be prepared to do them at home, in my opinion. I think we're going to have to be really careful. Not the time to get on a plane or a cruise or anything like that. The virus is here. And now we got to wait until they develop a vaccine. For those of us who are older, for those of us I'm caring for a 97, 91-year-old. And so I have no choice. I have to have an abundance of caution. I do want to say that the IC network, we are still open because we work from a ranch 20 miles away, and we work from my home because I care for elderly people. And so we are able to keep our doors open until somebody gets sick. And then I will shut the IC network down with respect to our warehouse for a period of time. The husband of my warehouse worker got sick yesterday or the day before. He says he's better today. It might be nothing. It might just be allergies. We had a ton of orders over the weekend because we got Cistro Protect back in stock. And just please be patient because we're going to be a little shorthanded because I don't want her to come in probably for a week. Let's just make sure that she doesn't get sick and all that sort of stuff. I don't want anybody sick sharing stuff. And give me a quick moment here. Let me just look at here real quick. Let me take a look here. Man, oh man. You guys are ordering stuff. I don't know what's going to happen to the supply chain for those of you who use Cistro Protect and the supplements. I have no freaking clue. What I can tell you is that we're keeping some stock in Utah so that if we have to shut down, we can drop ship out of Utah. Okay. And yeah, I'm gonna have to adjust these inventories. I have more Cistro Protect, just not in inventory right now. So if you're wondering why I'm talking about our store, it's because that's the way the IC network was arranged. So the IC network was started in 1993. No, actually, I started my first support group in 1993, IC network in 1994. And it was my doctoral dissertation for psychology. How could I bring support to patients who are homebound? So I found a doctorate at Stanford and using Narcotics Anonymous for home support, adapted that for IC, created my doctoral dissertation, presented my proposal to the ICA. They laughed, said it would never work. And that's exactly how the IC network was started. And ironically, I couldn't even do the doctorate because I was in so much pain from my IC for 5 years, I couldn't drive. But I'm very happy that 27 years later, my doctoral dissertation proposal continues to be the top website on interstitial cystitis in the world, ranked by Harvard Medical School and the University of London, because I am a stubborn son of a bitch and I'm not going to give up. All right, let's see. So, okay, that's enough of me. Let's take some of your questions here. Becky says, that's me. I drank so much Diet Coke every day for years and years. Yeah. Extract says, Jill, do you know if we are at bigger risk because of IC? No, I don't think so. There's no connection between the bladder and the lungs. The only time we would expect that would be for those of you who might be in an autoimmune subtype where you might have a Sjogren's syndrome or lupus or something like that. That's a very small percentage of people. Some of the best advice that I read though, and I was looking for the source for that, is really, really, really important if you are at the sore throat phase, although that's not, people don't really talk about the sore throat. People talk about fever, nausea, chills. You don't hear a lot of people talking about sore throat with coronavirus. But what they do say is that if you just make sure you continue to drink a lot of water, because that will wash the virus out of your mouth and out of your throat and down into your stomach acid where it will kill the virus. And so that's important. Stay hydrated. Cynthia says, thank you for the advice on Bladder Builder. It's working for me in lieu of Elmeron, which I've stopped. Yeah, baby. Woohoo. Love it, love it, love it, love it. Love it. Love success stories. Yeah, for those of you who don't know, Elmeron is now linked pretty significantly to retinal disease. Oh, I got to tell you something else. So, you know that there's this discussion about our president has been talking about these two drugs that when taken together, he says will help IC. Well, I mean, I'm sorry, will help coronavirus. And of course, unfortunately, that's incredibly reckless. And one of those drugs that he's talking about is Plaquenil. That's a brand name, Plaquenil. What is Plaquenil known for? Irreversible, no, not irreversible, retinal damage like Elmeron. Where if you take a lot of Plaquenil, it changes, it causes pigmentary maculopathy, it changes the cells of the retina. And so there are consequences to these medications. Also, if you double doses, it causes changes in heart rhythm that can lead to fatality. But anyway, the point that I'm saying, an interesting thing here is that Plaquenil is known to cause the same retinal changes that Elmeron is known for. But they've known about Plaquenil much longer. And what they found with Plaquenil is that the eye damage worsened over time, even after you stop the medication. But at some point in time, it started to reverse. Like, I don't know if it was years later, it started to reverse as I guess the body was able to get rid of the Plaquenil. I don't have the hard data on that, but anyway, ooh, it's warm. All right. Also, I saw a warning today about there were down in 2 cities in California. Uh, a gang is walking around in white Tyvek suits and walking up to homes saying that they can test you for coronavirus, and they're crooks. And what they do is when they get into the home, they steal from you. So they're not doing home to home coronavirus testing. Kelly says, "Where am I based out of meetings? Santa Rosa, California is where my home is, and our warehouse is up in Healdsburg, California. And right now we have 22 cases in our county." Molly says, "I got bad dry mouth too." I know. Hi, Amber. Hi, Jerry. Kelly's in Kentucky. Hi, Gina. Your dad made biscuits? I'll have one. Here, let me go get one so I can show it to you, okay? Hey, man, you know what? So like I'm really now, unlike in the past, because we have a finite supply of food. I'm being much more careful about eating leftovers, and like I made tacos last night and with a pound of ground beef that I got from Costco like a month ago that I had frozen. And we had about half the meat left over. And so I think that meat is now being served with biscuits. Hold on. Let me go get one. I'll show you what a 97-year-old can do. I'll be right back. Oh man. He made cheese biscuits. Look at this, my friends. 97-year-old made biscuits for breakfast. I haven't eaten anything yet either. I try not to start the day with white flour because I will bloat all day, but so I will save that for later. All right, let's go to Facebook. Yes, I do take phone calls about IC. Yep, I do. All you have to do is go to our website, icnetwork.org. We have an 800 phone number. I will tell you that the phones are getting pretty busy these days. And so the odds are you're probably going to have to leave a message and I will call you back usually within 24 to 48 hours, sometimes a little bit later. I'm also known for working fairly late at night. So if you call from the East Coast, I know that I'm still working at 5 or 6 o'clock California time, which means I might call you at 8 or 8:30 your time. Sherry says, diagnosed in 2000, my sciatic nerve kills me when I travel. Riding in a vehicle for over 2 to 3 hours, my bladder. Girl, yes. She asked, is that common? Absolutely. You are IC subtype 3, pelvic floor driven. You have muscles so tight, they're squeezing your sciatic nerve. Sciatica. I have sciatica on my left side also. Although we've been working on it so much, my sciatica uh, originates from a very weak SI joint, and my piriformis muscles are trying to hold my SI joint firmly together because it's too flexible. And sometimes my piriformis muscles get way too tight and they start squeezing that nerve. And so that's extremely common. And yes, your bladder absolutely is going to act up because some of those muscles directly. So think of your pelvis as a three-sided open box, right? So you've got muscles along the base and you've got muscles along the sides and along the back, right? So it's a three-sided and in the middle, and your sacrum is in the nerves come off of your sacrum and they go directly through the piriformis muscle. And then they merge to create the pudendal nerve. And then it splits apart again to innervate different portions of the pelvis. And so that's extremely common. If your piriformis muscle's tight, then you have to assume that your other muscles are probably tight too. And you absolutely need a pelvic floor assessment. Extremely common. Angie says she does not travel in her car any longer, an hour at the most. I'm the same way. I mean, I'm way better. My bladder is healed from whatever the hell was going on with my bladder 25 years ago, which was, we think, a chemical injury. But the legacy of where I am now is I am a I am a pelvic floor patient, and it's always on my left side. And it's fundamentally because I have scoliosis and I have one hip slightly lower than the other. And that's my hips are not functioning normally. And it's always straining the muscles on my left side and creating imbalance and stress on that joint. I was also a tennis player for many years, including professionally when I was in college. That's how I worked my way through college, was teaching tennis and playing tennis. I made more money teaching tennis than winning tennis, just you got to know. Um, um, but if you're a racket sport players, SI dysfunction is common. My physical therapist was also Yvonne Lendel's physical therapist, and he had exactly the same problem. If you're right-handed, it's going to be your left side. If you're left-handed, it's going to be your right side. All right. Ruth says, I'm scared to death. It's an epidemic. Off topic. On topic, I was told my bladder is beautiful. It's okay to be scared. We're all kind of freaked out. You know, for the first time in my life, I'm just going to tell you that I don't care how much I weigh. I don't care what I look like. Obviously I want to look good for these. There are just things that are so much more important than that now. And you know what? If I want to have a damn cookie, I'm going to eat a damn cookie. I'm not going to eat 5 cookies. I'm going to eat 1, well, maybe 2. I think we need comforting right now. And if eating a cookie gives a high point in your day, like it can be for me, go for it. Anything you can do to give yourself a little lightness, I support. I just don't want you to eat a whole pack of Oreos. Of course, you shouldn't be eating Oreos because they're chocolate, and chocolate can be irritating. Homemade snickerdoodles, win-win. Homemade sugar cookies, win-win. Oatmeal, good for the bowels. It was National Oatmeal Cookie Day earlier this week, and I did a blog on a great oatmeal cookie recipe where you can swap the sugar with applesauce, which is fine. You should be fine with that. Gigi says, when I had my first hydra distension, you were told your bladder did not look normal. The second one I had years later said my bladder looks normal, but you met all the clinical guidelines. Yeah, I did too. Kelly says, hard for me to stop the acidic drinks and foods I'm not supposed to drink or eat. Well, so what I would say to you is, if you had an open wound on your hand, would you pour acid on it every day? The answer is, oh, hell no. It would hurt. Well, you might have open wounds on your bladder. And if you're pouring acid on it every single day, what's going to happen? It's going to hurt. The worst part is that you're preventing it from healing. If I have an open wound on this hand and I pour acid on it every day, do you think it's going to heal? No, it will not heal. And that's a problem with the bladder. The bladder is the slowest healing organ in the body. It takes 2 weeks at minimum for one cell to be released, and now there's a suggestion that it might be 6 weeks. That the umbrella cells of the gag layer start at the base and slowly migrate to the top, and that could take 6 or 8 weeks. Well, if you have 1 soda a day or 1 soda a week, you literally are destroying your next generation of cells. And your bladder literally will not be able to heal itself if you are doing that. And so we always tell patients, I think it's really, really important that you stop coffee, you stop soda, you stop tea, all that for at least 3 months. And just let your tissues heal. When you think of IC as an injury or a wound, it makes your decisions about food much, much easier. But if you're thinking, this is an incurable disease, I'm not going to let it rob me of something that I enjoy, you're going to justify doing things you shouldn't be doing. And remember, we really think more of this as injury, traumatic injury to the bladder. The only ones who have quote unquote a disease process happening are going to be the viral patients, the Hunter's lesion patients, and maybe chronic fungal infections or chronic bladder infections, which might be a very small group of you. The majority of you could have, like for the person who said that they drank Becky said she drank Diet Coke every day for years. That's a superficial chemical injury to the bladder, and so think of it as injury. Joy says, I drank Diet Coke all through my working years. I believe that is what destroyed my bladder. I only drink water now, cannot drink coffee or orange juice either. You have Hunters now, had a fulguration done on March 10th. Joy, what's really sad is this is a perfect example of the food industry making decisions to sell products without any care for the health of their customers. And, their intention is just to get you to buy stuff over and over and over again. So how do they do that? Number one, they make it sweet because when you do something sweet, you trigger the addiction response in the brain. When you eat something sweet, you want more sweet and more sweet and more sweet. Whether it's sugar or whether it's diet soda, that's what happens. But the problem with artificial sugar like aspartame is it's like 100 times sweeter than regular sugar. And so when you put an artificial sugar in your mouth, your brain is immediately notified that energy is coming because sugar is energy. So your brain starts to prepare your body to use this energy. But it never arrives because it's artificial sugar. There's no energy attached to it. So 15, 20, 30 minutes later, an hour later, your brain's going, hey, where the hell's my energy? I need my energy. And because there's no real energy in that, there's no glucose in that or sugar in that, your brain will trigger you to start snacking. It's like, well, it didn't arrive, so I guess you better give me more. And what do you do when you do Diet Coke or diet products is you snack afterwards. And that's just your brain's reaction to being teased with sweetness, but not actually getting the energy. And that is why artificial sugar is associated with obesity, whereas regular Coke is not as associated with obesity. None of them are good. Again, human body wasn't designed for that high level of acid all day, every day. Best thing for you to be drinking is water because that's what your body needs, water. Or I do sparkling water, LaCroix sparkling water. And I do coconut milk and rooibos tea. Okay. Geraldine says, I tried Botox for pelvic floor and a month later, and I feel like it didn't help, but my doctor said it looks like it did, but it might take a while for you to feel it. I'm so disappointed because I thought for sure that was the majority of your pain. Well, I mean, Geraldine, listen, when they do Botox, you got to remember that it's not like they know exactly where the nerve is in that bundle of tissue that is causing that muscle potentially to be tight and dysfunctional. It's like when you get Botox in your bladder, they're going to just pick spots and do it. And sometimes you're lucky and they hit the exact nerve you need them to hit, and other times they miss that nerve because there's no way that they can visualize it and see it. And that's especially true for Botox in the bladder. I mean, Botox in the muscles. It's think of a steak. That's muscle. And they're injecting the Botox into that muscle, but that doesn't necessarily mean that they found the nerve. Your nerve might go an inch to the left. Everybody, we generally know where nerves are, but everybody's a little bit different. But the fact that he said he thinks it helped, to me is very, very promising. What I would want to know is are your are your muscles as tight today as they were before they did it? And whatever muscle that he injected, is that better or worse? See my little hole, my surgical hole just sting me. Arrgh. They said it would take a month. Yeah, see, I had a old root canal become abscessed. It was my biggest molar, and the roots were embedded in my jawbone. There's a big old hole. And unfortunately, he offered to put bone in there, but I was in so much pain. I just didn't quite understand the importance of it. And so I passed on it. And so now, when we eventually do the implant, probably 2 years from now, I'm going to have another surgery to put bone back in there, which sucks. Geraldine says, I think a lot of my issues with IC is muscle nerve related. I don't think the gabapentin is working. Geraldine, honestly, if that's what you think, then you need to order this book, Breaking Through Chronic Pelvic Pain, because this is the Bible of muscle and nerve problems that trigger IC. And this will help you understand your anatomy more than anything else. It's such a fabulous book. It's free on Kindle Unlimited. Come on, guys. It's freaking free. You can sign up for Kindle Unlimited, pay $6.95. Actually, the first month is free. So you can sign up for Kindle Unlimited, download it, read it, and then you can cancel it a month later, and at least you'll have the info. If you would prefer a paper copy, you can get it in our store for $29. Make sure you select media mail because that's the cheapest mail. If you do it priority mail, it might cost $15 to send it because this is a meaty book, man. It's over 400 pages. It's heavy. Weighs over a pound. Trudy says, hello, everyone from Charlotte. Hello from California. Geraldine says, does anyone have more pain issues on one side of their body than the other side? Absolutely. And that also is a sign of muscle rather than bladder. If it were bladder, it would be focused directly above your pubic hair and behind your pubic hair. If it is to the left or to the right, then we're always going to be looking at muscle and nerve and bony structures. Vicky says, structural. My right knee is lower than my left. Everything tilted and overcome. Exactly. Exactly. Perfectly said, Vicky. Hello, Joy from Grants Pass, Oregon. Donna, our wonderful manager for our support forum, lives in Oregon. She's 85 years old and she still works for the IC network. She loves helping patients and she's damn good at it. Geraldine says they never did a hydro, just a cysto without. Doctor said he couldn't see anything. Well, that's good. I mean, I've had 2 cystos. That's fine. That's fine. The good news, he didn't see anything. Now, if you were bleeding, if your symptoms were worsening rather than getting better, then it would be reasonable to have somebody look in your bladder with a hydrodistension. But, hydrodistensions are not required for a diagnosis of IC. They're only recommended if your diagnosis is in doubt or if you're getting worse. And, I don't like guessing. I like facts, right? And so, at least for me, if I'm in pain for any period of time, I want somebody to look sooner rather than later. And the one time I didn't do that, it was early uterine cancer, and I really almost messed up. It's important to at least go to the doctor and have them take a so that's good news. So that tells us, look, that helps us. What was that? My neighbor. Hello, Brenda. Hi, Sue, Molly. Oh, dear. Oh, Jill, I fell on my tailbone every year at wintertime during my childhood. Could that have caused this? Oh, hell yeah, Molly. Definitely. What does Dr. Weiss talk about in the book? A recurring pelvic trauma. Carolyn says, what are some other nerve pain meds I can take for pain besides gabapentin? Hun, I got a supplement that's really good with research to back it up. In Europe, they have been using something called palmitoethanolamide for more than a decade. What? Oh, that's part of, what is that? Okay, that's weird. Palmitoethanolamide has been used for more than a decade for chronic pain, especially nerve pain, sciatica, burning mouth syndrome. And last year, we had our first study from Europe using or studying the effectiveness of PEA with interstitial cystitis. And guess what? It was spectacularly successful. And so it was a research study from Italy. And I had known about PEA for easily a decade, maybe longer than that. It was just too expensive to bring to the United States. It would cost thousands of dollars for literally one bottle. But since then, they have improved manufacturing. And finally, somebody in Italy decided that they wanted to study it with IC. And what that study found was a combination of PEA and resveratrol at 3 months. 87% of patients had a significant reduction of pain. And at 6 months, every single patient taking it had a significant reduction of their pain, and 25% were pain free. Because we can't get that formula affordably here in the United States, Natural Approach Nutrition has made a variant of that formula called Peora. And this is the supplement that I take because I get a lot of skin pain and a mouth pain from being super sensitive. Um, and It's $29. It's literally one of the cheapest supplements out there with research to back it up. Now, there's nothing in this for the bladder wall. This is just for pain, ideally. Well, all this what the studies show it seems to be the most effective for nerve-driven pain. And so, Geraldine, I would try Peora. Bladder Builder by the same company has ingredients in it that will support the bladder wall, like chondroitin and quercetin and collagen, but it also has PEA in it too for the pain fighting effect. So now we have 2 supplements that have an ingredient that have the potential of helping with pain, that don't come with the side effects of Neurontin and stuff like that. That was a cool thing in the PEA studies. Literally, well, the IC study showed no reported side effects. And I have to say, I'm super sensitive to stuff. I've had no side effects from this, none. Now, I never take a lot. I always take a half dose of everything. The max dose for this is 2 a day. I just take 1 every couple of days whenever I feel things getting weird. And it really helps me. Okay, I'm doing something I shouldn't be doing, and that is I have 1 foot up on my chair, but it is what it is. Daniela is speaking Italian, and I don't know Italian. Salve ragazze, sono Daniela Italia, sto assumendo allo Desert Harvest e mi fi molto bene. Ciao, siamo in un brutto momento, peccato che non capisco la dislingua. I'm sorry, I don't know what that means, except I think you're saying it's Italia assumes. Okay, sorry. I'd have to put that into a translator to understand it. Geraldine says, I wish I could eat tacos. Well, hun, listen, refried beans are fine. Just don't get spicy beans, get mild beans. Corn tortillas, flour tortillas are fine. Cheese is fine. Avocado is usually fine. You can have tacos. on the IC diet. You just probably can't put hot sauce on it, or maybe onions, or maybe tomato. I didn't put tomatoes on ours. I usually get yellow cherry tomatoes and cut them in half, but um, I'm just kind of rationing food a little bit. Sarah says, I would love to reach out to an expert. I'm from Canada and it seems there's no one to talk to about IC. My GP won't prescribe Elmeron because it's primarily a United States. What? Oh, that's stupid. Come on. Come on. Elmeron has been available in Canada for decades. I know that because the old Canada IC Society turned down a huge grant from the company. And the company called me and said, why wouldn't they take our money? That was years ago. That was like 20 years ago. Of course, the Canada IC Society folded, and but there's a new IC group that's trying to get started that you can find on our website under support group listings. That's potentially a new national group for Canada to represent IC patients. But Sarah, what I will tell you is a lot of Canadian patients come down to the United States. If you are in Ontario, you're just less than an hour away from one of the top doctors in the United States, Dr. Ken Peters, right outside of Detroit. Come on, it's a boat ride or a quick plane flight. And so if you are kind of a more complex patient, if you're not responding to therapy, if they're not giving you anything, if they haven't assessed your pelvic floor, anything at all like that, you can come potentially to the United States, although I think the border is closed right now. I'm not sure what's happening with the Canadian border. I thought I heard that it was closed for travel. There are a few doctors in Canada that do treat IC. Your best bet is information. You got to build your knowledge level so high that you can walk into any doctor's office and train them. And so, at a minimum, you have to get this book. Whoops. You have to get this book, Breaking Through Chronic Pelvic Pain, the best book written on IC and pelvic pain and vulvodynia and muscle issues. Best book ever written, in my opinion. And if you read this, I've read it twice. I'm probably going to read it a third time. If you walk in with the knowledge of this book, you will be able to direct your medical care much better. You are an anatomical mystery to be solved. I also want you to come on over to our website, again, icnetwork.org. And I want you to go specifically to the section of confusable conditions. It's a new section to our website, confusable conditions, because that will show you all the things we want to make sure you rule out, like fibroid tumors, endometriosis, Tarlov cysts, and the lead story in our magazine. So you guys, our magazine finally out. I had to hold it for a couple weeks. I wanted to finish up an interview with Dr. Weiss, the author of that book. Our winter magazine came out the first day of spring. Sorry. And our lead story in this is, could mold toxicity cause IC symptoms? And the answer is yes. And that was an IC patient who figured it out. They discovered that in her house, they had a massive black mold problem in the foam of her carpet from an old leak. And when they treated the mold and got rid of it, what do you think happened? Her IC disappeared, her symptoms disappeared. And so I assigned Stacy Shannon, my lead writer for the IC Network, to do an article on mold toxicity. And what did she find? Urinary frequency is a well-known symptom of black mold and mold toxicity, along with fatigue, weakness, aches, muscle cramps, ice pick pain, headache, light sensitivity, red eyes, blurred vision, tearing, sinus problems, cough, shortness of breath, abdominal pain, diarrhea, joint pain, stiffness, memory, concentration issues, word recollection issues. God, well, that's okay. Do I have black mold in my house? I know I do not have black mold in my house. Well, maybe under the bathroom floor. No, I just had it. No, 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 no. No, no way. I had it replaced like 5 years ago. I just say that because I have moments where I have trouble recollecting words. Decreased learning of new knowledge. Oh, okay. Confusion, disorientation, skin sensitivity, mood swings. Nah, I don't have mood swings so much anymore. Appetite swings. No. Sweats. No, I don't have night sweats. Temperature regulation or dysregulation problems? Yeah, every now and then. Excessive thirst? No. Increased urination? Every now and then. Static shocks? Yeah. Numbness? No. Tingling? Yeah. Vertigo? Every now and then. Metallic taste and tremors. I have a man cave underneath our house. It's my dad's radio room. It filled with radios, and I can't wait to tear down the walls and look at the brick on the outside. I have to wonder because we have had leaks down there. Crap. Trudy says, I have rheumatoid arthritis, Sjogren's, I'm diabetic, and I see with Hunter's ulcers. Do you have in your store a probiotic I can take? Would Bladder Builder help you? I think the Bladder Builder would be a really good choice for you because it has the probiotics in it combined with the PEA in it, which might help your Hunter's lesions. But it's important to make sure your Hunter's lesions get treated. An untreated Hunter's lesion will cause a lot of pain, but when you treat it correctly with a steroid injection, or you laser it or cauterize it, or you do hyperbaric oxygen therapy, the pain can reduce up to 85%. I mean, the results for Hunter's lesion therapy are really, 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 really good. Sue says, I'm grooming my last dog today, my own. I can't believe salons are still open in Michigan. So much rush to client grooming. Yeah. I don't think we'll be getting our hair cut for a long time or going to the spa or getting a facial. You watch, my eyebrows are going to get whiter and whiter and whiter because they are basically this color. Joy says, I've heard you say Elmaron doesn't help if you have Hunter's. I had my 6th fulguration surgery on March 10th. Can you explain, please? I've been on Elmaron going on 8 years. No evidence of retinal disease. I'm supposed to see my eye specialist in April, but I'm afraid it will be canceled. Well, I mean, think about what Elmaron does. Elmaron is the equivalent of a coating. It's a chemical Band-Aid, right? So if you have a wound in your bladder, so let's just say that gosh, how can I do this? Let's say that your wound is the size of a dime. Okay. Let's say your ulcer is the size of a dime. The molecule of Elmaron is very small. So it's not like one molecule is going to fit the dime. Basically, what happens is you end up with the chemical uh, slowly building from the bottom up and trying to create a coating, but it can get washed out very easily. And, ultimately, and again, remember, Joy, what the research is saying. Research is saying, and this is what makes Hunter's lesion patients different from everybody else, is when you biopsy a lesion, there is massive inflammation. Everybody else, the rest of us, do not have the inflammation that you have. That lesion is a hot spot of inflammation. So what does that mean? That inflammation means your body's fighting something. Inflammation is biological warfare. That's your body is is mobilizing white blood cells to the area. There's just a big fight happening in that area of inflammation. So the question is why? And the answer might be, again, that it's a virus living on the nerve that's in that area. There are kind of two operational theories for Hunter's lesions. Number one, that it's a nerve that is massively inflamed, that is releasing substance P, which is breaking down the tissue in that area, or that it's a virus living on the nerve. And now we know why lesion patients, recur. The lesions can recur after they're treated. Sometimes they do, sometimes they don't. But why they don't generally respond to Elmaron and other bladder medications like that? Because if it's a viral infection, those medications do nothing to restrict a virus. And we need the rule every time I say virus, y'all should take a shot of something, water. And if we can, okay, I said virus, I'm drinking a glass of water. I'm going to take a sip every time I say the V word. So generally, Joy, what the research studies show is that Elmeron really has very little success with Hunter's lesions. Lesions require lesion-specific therapy. So when they did the fulguration, I would want to know, did they also inject triamcinolone? Did they inject a steroid into the lesion, which can help calm some of that inflammation? That would be the thing that would be added. Some doctors, they'll do the fulguration and they'll do the steroid injection, or they'll just do the steroid injection. The other thing too is, did you ever have mononucleosis? If you ever had mono, we now have research study that found the Epstein-Barr virus in the urine of patients with lesions. I did it. I said it again. That's a good rule. Cynthia down on YouTube says, you were exposed to somebody with a virus. You're going to be tested tomorrow. Good luck, hun. Sending lots of prayers your way. Can wearing tight pants cause pelvic trauma? Yeah, because it'll restrict blood flow. In addition to abrasion on your skin, especially from a big seam, if you're prone to vulvodynia, if you've got dry skin down there, putting on something with a giant seam that's rubbing on your vulva whenever you walk is going to create irritation. But tight pants are also going to compress tissue, and it's going to potentially restrict blood flow. And so this is not the time. Hey, man, go over to naturallife.com and order my onesie. It comes in green, khaki, or black. I also bought overalls. I love this. I love this. Listen, I am 59 years old. Like, how the hell did that happen? I do not dress like my mother's generation. They would be wearing corette pants with perms and short hair. In my brain, I'm 25 years old. I would have loved to have worn this in my 20s. I am going to wear it in my 50s. I'll be 60 in July. What the hell? How did that happen? I have no freaking clue. It's so weird. Sandy says, does green tea apply to the list to stay away from? Hell yeah. Green tea is agony. No. Green tea is very high in acid and very high in caffeine. It's just as bad as an espresso. You cannot be doing green tea or green tea extracts for weight loss, anything at all like that. That's going to hurt like you know what. Sonia says, I've had pain on my left side since the beginning, but a year ago, pain on the right side started, and it's much more intense. Right side will spasm even when relaxing with my feet up. Yeah, that's because your right side has been compensating for your left side for so long. What that means now is that they're obviously making progress on your left side. And so the muscles are readjusting. I have the same issue that my pain on my left side is very low. It's down by the sit bone. My pain on my right side is higher up on my glute. And you can tell that as we're strengthening the left side, the right side is now saying, what the hell are you doing? Stop changing things. So they're just compensating. That tells me something productive is potentially happening, but now you're going to have to do right side therapies too. So for me, the big thing is a foam roller. Using a foam roller is the way to go for a lot of this. I'll be doing that after I'm done. Molly says aspartame also kills kidneys. Yeah. Gigi says, I might want to add those of you that have fungal issues. I had a notes test and found that I have a lot of fungus, so I don't do well eating sugar of any kind. The fungus feeds on it. Yeah, and interestingly, in this latest issue, the IC Optimist, which you can sign up for on our website, $25 for 4 issues for the year. We presented all the key research from the MAP Research Network, and the study that I think was the most interesting was from a year ago. A study published in April 2019 looked at the role of fungi in female IC patients. Researchers collected midstream urine samples from ICers at the beginning of the study and then again at 6 months and 12 months. 13 fungal species were found overall in the samples collected from 202 patients. Patients with more severe symptoms showed a greater fungal diversity as well as an increased presence of candida. Now, we knew a couple years ago when they were setting patients with flares that many patients with flares were actually struggling with candida infections in their urine. And of course, a typical urinalysis does not identify fungus. Only a next generation test is the best way to identify fungus. And so think about it. Think about it. Now, knowing what we know, go back 10 years. For everybody who had a flare and you thought you had infection and you called the doctor and you said, "Hey, man, I think I have infection. I need some antibiotics." And your doctor gave it to you, or worse, you self medicated. Well, you know what you did is if that was a fungal infection, you just made the fungal infection that much worse because the antibiotic would have destroyed the bacteria that normally eat the fungus, right? That's why candida infections happen. Gigi says you had an oats test by a functional medicine doctor, and it was discovered that you had a lot of fungus. You went on the anti-candida diet, no sugar whatsoever. Sugar flares me. Yeah. And I had jelly bellies last night. I probably had 20 jelly bellies, and I just always kick myself afterwards. Like, stop it. You don't need to eat candy. Trying to save your freaking teeth, for God's sake. I have had 7 root canals. My childhood dentist hollowed out our teeth and filled them with mercury when we were young. So my siblings and I, this whole generation back from the 60s here in Santa Rosa, we all went to the same childhood dentist, and he just destroyed our teeth. And so I got crowns everywhere. The only thing that's not crowned are here and here. Everything else is root canaled and crowned, with the exception of one on this side. Cost me $25,000 about 10 years ago to fix it all. That was my loss in new car. I was in so much freaking pain from all these cracked teeth. It was ridiculous. Geraldine says, if it's structural, do I still have to watch what you eat and drink? I see it's so confusing. Well, yeah, you do, because of what we call the somatovisceral reflex. So with the somatovisceral reflex, what that means is that muscle dysfunction can change an organ, your bladder wall. And so if you've got super tight muscles, that's ultimately going to end up messing with your nerves, creating sick nerves, and those nerves merge at the spinal cord with your bladder nerves. The bladder nerves then become kind of sick, dysfunctional nerves. And then that reflects back down into your bladder wall with the release of substance P. So that means your bladder. So that is, in essence, this. That's kind of what the guess is that that's underlying a lot of what this looks like. And that's little areas where nerves are releasing potentially substance P. I mean, that's the theory. And so, yeah, your bladder wall's compromised. And so you got to follow the diet. But for these patients, like if you're that patient who your symptoms began after you fell on your tailbone, or a rape, or a car accident, or a history of athletics, y'all know the bladder therapies will only get you so far. And the reason why is because they're not addressing the underlying issue, which is poor circulation from tight muscles. The therapeutic priority for somebody whose symptoms began after a pelvic trauma is to restore blood flow. And the way that we do that is with pelvic floor physical therapy. You could spend years on bladder therapies and never get better, and never get completely fixed. And again, this book explains that really, really well. The myth, there's all, and even in this book, Dr. Weiss, the author, pelvic pain specialist in California for 50 years, he became a master detective. So he could find trigger points in the pelvis. He could fix those. He could calm nerves down. But what baffled him is, why do they keep coming back? That a patient would flare. They would come back 2 weeks later, or 2 months later, or 6 months later, or whatever. Why were these patients coming back? And underneath it all, what he consistently found was a skeletal abnormality. And for 90% of his patients, it began with a foot problem. that patient had Morton's toe, or that patient had plantar fasciitis or Morton's neuroma. And what that does is that creates imbalance in your walking. If you've got one leg longer than the other, you've got the shorter leg is going to have a bigger arch, and the longer leg is going to have a more shallow arch, right? When you're walking, right? So one leg, the longer leg is flattened, the shorter leg is arched like that. Well, what does that do? That creates an unnatural angle in your hips and puts extra stress on your pelvic floor. And so the missing piece for many of his patients actually was fixing the bony structure, whether it's the SI joint, with prolotherapy to try to strengthen the ligaments there, or fixing a foot problem. And tons of case studies in that book, tons of success stories. Sonia, what is the best way to explain IC to other people? That it's a pelvic injury. And what the biggest problem with it is trying to figure out where the injury is. The injury could happen to an organ. It could happen to the bladder. It could happen to the urethra. It could happen to the uterus. It could happen to the vagina. There could be some condition there, or it can happen to muscles, or it could happen to nerves. And because the pelvis is such a small confined space, an injury in one area is generally probably going to affect everything. And the flaw with Western medicine and the flaw with Western medicine specialists like urologists is that they stick to their box. They stick to the urinary tract. They don't necessarily look outside of the urinary tract to how the muscles will influence the bladder, because that was not taught in medical school. It's still not taught in medical school well. Joyce says, you did buy the book. You're still reading it. It's awesome. Isn't it though? And Dr. Weiss now, I think he is like 80 years old. And he's in poor health. And it's so important, I think, for us to let him know what a gift this book is. It took him 15 years to write it. It is a love letter to chronic pelvic pain patients. It goes through anything and everything that could be contributing to your pain. And it is a master class in the pelvis and in pelvic anatomy and all the influences of pelvic anatomy. The first 4 chapters are just, they are literally, they teach you your body. That there are 3 layers of muscles. He teaches you where the nerves are located. Look, this is the nerve emerging from the sacrum. And you can see it's going right through the piriformis muscle, where then it goes through the Alcock's canal, which is influenced by the obturator muscle. And then it splits into the areas that it will innervate, like the clitoris. So for patients with persistent genital arousal disorder, where you feel this really icky, awful, painful arousal sensation 24 hours a day, that is, in fact, caused by very tight muscles squeezing those nerves. This book is a masterclass at anatomy. And again, for the woman from Canada, girl, if you read this book and you really absorb it, take notes, you will walk into your doctor's office more knowledgeable than any of the doctors you're going to see about pelvis. When I read it, I just want to show you what I did. I had bought this as a Christmas present for one of my nieces, but I kept it. I'm really, really glad I kept it, because I have written my own mini book of notes based upon what I have learned in this book. And what I did, I'm very, for me to learn something, I have to rewrite it back down, and then I color it. I do. I color it. So that I really understand relationships. So look, you can see what I did, so that I colored the different nerves. And that's how I got my way through a very, very hard pharmacology degree. And kicked my butt, but I did it anyway. Whew, hard degree. Connie says, I swear I've got mold issues. My doctors all look at me like I'm nuts. Well, you are an anatomical mystery to be solved, my friend. You got a lot of stuff to rule out. So please come on over to the IC Network website and go to the confusable diseases section in the IC section of the website. And look at all those confusable diseases. And there's your checklist. You're just going to have to work down that, try to figure it out. Geraldine says, I think we have black mold in our bathroom. Husband is planning on redoing it this spring. Hey guys, seriously, you're all at home right now. This is a perfect time to do a spring cleaning in your house and look for stuff like that. I desperately need to clean out the closet right here. Desperately. There's a big old um, um, chest in there, hope chest in there. I don't even know what's in it. Dreama says, your gynecologist said you had endometriosis. He operated, tried to get it all. He said he couldn't get it all out in the back. I've been told when you're over 50, you can't have endo, so it shouldn't cause me problems now. What's your opinion on this? Well, I mean, so what is endometrial tissue? Endometrial tissue is uterine tissue that's migrated into your pelvic cavity. And because it is hormone sensitive, that tissue will bleed when you have your period. And believe it or not, blood pooling in your belly is incredibly painful. Blood is meant to be in blood vessels. It is not meant to be floating through free structures in your abdomen. And endometrial tissue can migrate. It can go all the way up to your heart. It can go up to your lungs. It can go wrap around your bladder. It can wrap around your bowel, all sorts of stuff like that. But he is right that you might still have endometrial tissue, but the good news is now that you're menopausal, you're not going to have periods anymore. And so that should dramatically reduce your pain and discomfort. But it's not necessarily going to deal with adhesions. Endometrial tissue is very sticky. It wraps around stuff. And so if you've got endometrial tissue that's wrapped around a blood vessel or wrapped around an organ or wrapped around your bladder, then at some point in time that might need to be loosened. But he is correct that at least it should not be bleeding once you're menopausal. When you ever wonder why we women get a belly after a period stop, and that's because it's kind of a last ditch effort of your body to store hormones, because estrogen is stored also in fat, and they think that that's why we women get the menopause belly, and that why it's so difficult to get rid of the menopause belly. I have a little bit of mold in my shower, but I just put I just had I just had my shower redone because it was leaking again like 5 years ago. And I just spray it with bleach and the mold goes right away. I just spray it down with bleach, or I put not Ajax, the white stuff, the white liquid, whatever, on it. Put it in there for a couple hours, fine. I also wash my glass doors on my shower with a half a lemon, and the citric acid from that will take off a lot of the dried water. Trudy says, "Can you give us your private Mac email address? It's super easy. It's right there. icnetwork@mac.com. icnetwork@mac.com." Molly says, "What if you have fallen arches, one leg longer than the other, and scoliosis? Am I screwed?" Girl, hello, sisters. We're sisters, right? I mean, I have scoliosis. I have one leg that's slightly longer than the other. No, you just try to get them. You gotta adapt. You gotta if you can use arches, you use the arches. Orthotics would help tremendously potentially. You're not screwed. It is what it is. It is our lot in life that we were given scoliosis, and so you got to stay strong. Don't let your body get super weak. Continue to work your muscles. I find working balanced is good. I try to, like, for me, swimming, backstroke was just the best thing for my scoliosis and for my back. So you just gotta keep moving, keep your muscles strong. Don't lay down a lot, even though it's tempting right now. I mean, it's okay to lay down when you're in pain, but you got to get up and move too. Got to keep those muscles healthy. John Lee, and John Lee, I know you told me what you on your husband's account. I don't remember what your name was. I'm sorry. You had polio as a child. In your senior years, you got pelvic, lumbar, bladder, and muscle mess. My specialists get a glazed look dealing with my PFD. I also had in my support group here a patient who was a polio patient, and she was in the same situation. Hello, Corrine. Heidi says, how do I handle going to the ER while dealing with the coronavirus? Well, technically, coronavirus patients are not supposed to show up at the ER unless they've called in advance. And now they're kind of going into separate entrances, and there's a separate screening process. I think you just have to call the ER and ask them what to do. And, again, if you don't have a mask, you can make masks, guys. I made this yesterday. I think going out and I am happy to give some of these away. I mean, I'm going to make a ton. And so I would be more than happy potentially to, maybe what I'll do is I'll put some in our store. I mean, I've got enough fabric probably to make 2 or 3 or 400 of them, and just charge you shipping or charge you $1 or 2, just to whatever. But you can make these yourself, and you don't have to use elastic. I only have a certain amount of elastic. I'm looking at it on the floor right there, because all my sewing stuff is over there. I'm also going to be making it with ties, and I'll show you. Hold on a sec. Let me show you. This is all the leftover quilting material, because I quilt too every now and then when I have time, which is not often. The next group I'm going to make are going to be pinks. So I'm going to make a bunch that are pink and dragonflies. This was a quilt I made for my niece, my nephew's daughter, right? So if you would like, I mean, if none of you are sewers, and of course, when you get it, you just immediately put it in the, don't just, because I will have handled it. Now, granted, I'm not sick, but I'm not making them with gloves. When you get it, you would just throw it right into your washer and wash it on hot, and you should be fine. Wash it. You could even wash it a couple of times. But anyway, if that's something that you would find helpful, I would be happy to try to make some and put them in our store. And again, try to like $1 plus shipping. And the shipping would be, I mean, can I stick it in an envelope? Hold on, let me see. So I might even be able. Okay, so like here is our envelope. Look, I can get one in an envelope, no problem. So, your shipping would be 50 cents. Anyway, you let me know if that's something that I can do for you. I would be happy to try to do that for you. We're all going to be going stir crazy. I've got a lot of projects that I can work on, but one thing I tell you, I went walking yesterday, and I stopped so I didn't walk behind other people, even though they weren't coughing. It's important to move around, and it's important to walk up and down your street, but please stay away from big crowds. Would it be beneficial for me to get an IUD or shot so I don't get my period because I flare every month? I don't know. You have to talk to your doctor about that. I just don't know. Angie, I always talk about adhesions and scar tissue. I worry seeing so many young women doing all kinds of unneeded surgical procedures that are just causing more issues. Remember my adhesions from my ribs to my hip completely smashing your colon flat for over 8 years. Girl, Angie, seriously, I would love to tell your story. If you would ever like to write up your story and what happened with you with those adhesions, I think and especially if it affected your bladder, and how it affected your bladder. If you're willing to write it up, I would love to share it with others. Yeah, Molly, remember the human body is not when the more you lay down, the weaker your muscles get. So, sit and sitting, same thing with sitting. The human body's meant to walk. And so, try a 30-minute nap, hour nap, reading a book on the couch, not a problem, but you shouldn't be on the couch for 10 hours unless you're in serious pain. Sue says, I'm confused about the masks. The news says not to wear them unless you're sick, that they make you more vulnerable. Well, um, an N95 mask is going to eliminate, if I remember the statistics, 97% of the viral load because the particles are so small. And then the next step down from that was a vacuum cleaner mask. But you got to be careful. Something made from a vacuum cleaner bag because some of those have glass in it. And if you breathe that in, you're going to get glass in your lungs. And that's very, very bad. And then you kind of move down to fabrics. And so there was a hospital, I think in Indiana, who said they desperately needed masks, and they gave a recipe and a video, and that's what I followed. And mine are either 2 or 3 layers of cotton, which will eliminate 50 to 60% of any viruses that you might be. And to me, it's better than nothing. I mean, I am now going to be wearing a mask when I go to the store for sure. And if you go to the emergency room, listen, when you come home, you got to take all your clothes off in your garage, and you got to spray off your shoes, the bottom of your shoes, let them soak in bleach overnight or something overnight that would kill any bacteria that you might have, or viruses you might have picked up from the store. Molly said you'd be grateful for this mask. All right, my friends on YouTube, what are you guys doing? How do I go to the ER with the corona disease hitting there too? Same thing. I mean, this is the time to really build your toolkits, guys. And again, if you're struggling with pain, and supplements. Listen, what if we get to the point where we can't send out supplements for one reason or another, supply chain or whatever? Then reduce your dose so your prescription will last longer. So if you normally take 4 a day, take 2 a day. It'll go twice as long. And again, with your pain, number one, you got to try to figure out what kind of pain you're having. If you have pain as your bladder fills with urine that is relieved by urination, that's your bladder wall. And so what are you going to do for that? You're going to drink a lot of water, dilute your urine. You got to be perfect with your diet right now because again, it's going to be challenging, to get care right now. Number two, you want to do something that will numb your bladder wall, like azo. You can buy azo over the counter. We have it in our store, in our warehouse. I don't know how much we have. Somebody just bought a whole bunch of it, and I might be getting to the point where I'm going to limit purchases to 2 instead of more. I don't want anybody hoarding their icy stuff. We got to be fair on this. Um, doing something like Bladder Builder or Peora, which would have a pain fighting effect, might actually be that missing piece for you. But if you're in pain because you've got tight muscles, then you got to do the muscle protocol. So you got to use heat if heat helps. You got to do your stretching, you got to do your physical therapy. I mean, whatever exercises a physical therapist tells you to do at home, et cetera, et cetera. And hot showers, hot baths, if heat works. And if you're a patient where if cold works better, then the cold really points to the fact that your nerves might be more irritated because cold is calming to soothing and nerves. And again, something like Peora might help get you over the tide. And again, we have the research to back it up that this can be particularly helpful for nerve pain. So it's an option. And I want you to at least have options. And so does the American Urology Association, because in their IC guidelines, in step 1, they say, try the supplements. It's available. It's an option. There's no way to say if it's going to work for you, but it's something you can at least try. Joan says, my daughter made me gluten-free blueberry scones. Nice. Cynthia says, exposed to someone who's, okay, we said the word, but I got to take my shot. So Cynthia, I being sent to a retinal specialist because my ophthalmologist 3 weeks ago found some retinal issues that he wants for the diagnostic. I'm not amused. Elmeron is poison and should be gone. You know, I mean, this is where it's really tricky because in our survey, 54% of the almost 2,000 patients who filled it, who were using Elmeron, 54% reported eye disease, which means that 46% did not have eye disease, which means it was helping 46%. And in the clinical studies where they go back and look at patient history and they ask them to come in for eye exams, they're seeing 20 to 25% of patients using Elmeron have retinal issues. But that means that 75 to 80% don't. I don't want to pull it from the market because it's helping some patients, but I think we have to be very, very vigilant. And I think that's why we asked the FDA to change the label to request annual eye exams. And the FDA said no. They had other priorities other than protecting the eyes of patients using Elmeron, which pisses me off. Carol says, Azo helps, but they say you shouldn't take it too long. It does make your pee turn bright orange. Do you know why that is? Yeah, because I think it either leads to either a kidney issue or a liver issue. I think it's a kidney issue. And so Azo really is only meant to be taken like, 3 to 5 days, 2 to 3 days. And then it's really not meant to be taken every day. Although that said, some patients do take it every day. Angie, thank you. Yeah, I saw that email come through. All right. So, I have something very cool. And that is for my giveaway today. I had a patient, Bev Lauman's daughter. Bev Lauman is the author of A Taste of the Good Life, and I am totally zoning on her first name right now. I apologize in advance. Look at this. She made the cutest heating pads, and there are little bladders on it with the awareness bracelet. And so I think that I've got 3 of them. So what I'm going to do is I'm going to give 2 of these away. I'm going to put that one over there. So I have got microwavable heating pads to give away today. Now, the caveat is it's got to be able to fit in a box. It's probably going to cost $15 to fix it, to send it. But anyway, this is my giveaway. And also, one more thing. Hold on. One of our winners of the book last week did not send me her address. So, here it is. Sandra Chiardelli. One more week. I'll hold it for one more week. I've got the book Breaking Through Chronic Pelvic Pain for you because you won last week. Okay, so this week I'm giving away heating pads that were generously donated. Now, these do not come with instructions, and they are made, I think, with popcorn. It's not rice, it's popcorn. So obviously, if you get this, please do not microwave. Actually, not popcorn, corn. It's not popcorn, it's corn. You're going to microwave it to make it hot. Don't microwave it for 5 minutes. We don't know how long you're supposed to microwave this. Start with a minute or 30 seconds and slowly work your way up, please, because I'm not carrying any liability for this. There's no instructions. You got to go slow. Okay. So let's give these away as our gift today. And so the question then is, Cynthia says azo can affect the red blood cell production in your bone marrow if you take too much. Cynthia, thank you thank you. I appreciate that. Interesting. I got to remember that. All right, so let's do this giveaway. Who wants a heating pad? A free heating pad. Isn't that cute? Perfect size. Look, it'll fit perfectly over your pelvis or over your, for me, I would shove it underneath my left butt cheek on my piriformis muscle. So we need a question. Okay, I need a question. Yeah, it has to be a hard question because even though I didn't make it, I've got to ship it and it's going to be expensive to ship. And so I just not going to hand it out. Yeah, you're going to have to work for it a little bit. Oh, I had a game too. I had a game I thought we could play, but maybe we'll save that. What would be a good question? Name. Okay, here you go. Now this isn't going to apply. I mean, anybody can do this. If you paid attention, you will know this. Okay. So one on YouTube, one on Facebook. Name a treatment for Hunner's lesions, not Elmeron. Name a treatment for Hunner's lesions. First person on YouTube, first person on Facebook are going to get a heating pad. Oh, come on, you guys. This is not hard. There are 3 treatments for Hunner's lesions. And I've said them a couple of times. All right, we've got somebody biting on. All right, Carol Morgan. Oh, Sonia, if nobody on YouTube gets it, you'll get the second one. All right, so Carol Morgan, you're going to get one. And Nikki on YouTube, you're going to get the other. I need both of you to send me an email. And my email is super easy, icnetwork@mac, as in M as in Mary, A as in Apple, C as in Charlie.com. Please send me an email with your mailing address and I will send you both that. And who knows? I might even throw in one of my masks in that order. But you guys didn't tell me if I continue to make more masks, if you would like them. Look at you guys. All right. Sonia got it right. Sue got it right. Christine got it right. Joy got it right. Connie got it right. Not Cynthia is asking if a heparin installation would be a treatment for Hunner's lesion. And the answer is no, it wouldn't. It might make you feel temporarily better, but it's not going to do anything for the lesion itself in terms of trying to calm the lesion down. All right, guys, we've been going for 2 hours. I have to have a box that it will fit in for me to send it. I mean, I can't send it media mail. I might be able to send it first class if it will fit in a box or an envelope I have. I am not going to the post office and I'm not going to, I mean, it's limited to supplies on hand, my friend. The giveaway, Vicki, was these wonderful heating pads that were donated by an IC patient who made them right around Christmas, and they've been sitting here on my desk waiting for me to do that. All right, guys. So we've been going on for about 2 hours. I'm trying to keep these short just to protect my surgical site. So last call for questions. Last call for questions. All right, Carol. I will see what I can do. I want to make a bunch more. They're not, listen, they're not pretty. You're probably going to have to trim some threads because I'm going fast. And the stitching, I mean, the stitching isn't terrible. It is what it is. Last call for questions, my friends. Last call for questions. Otherwise, I'm going to go eat something because I haven't eaten anything yet today. And I don't know, read a book. Maybe read a book and then start working on my masks again. All right, I'm going to give you your homework. You always have homework, 1 hour a day, 1 hour a day. For 15 minutes, do something for your soul and your spirit, something that will give you comfort. We really need it right now. Listen to Joel Osteen or a church service or watch butterflies dancing on the wind outside your window. Something that would just give you peace. I need you to do 15 minutes for your bladder or your pelvic floor. Come on, get on your back, do your exercises. You can do it. I have to do it today. I need you to do 15 minutes to improve your knowledge, although technically you've done that because you've attended this lecture, and that's cool. And I'm really, really glad to help you. Last but not least, I need you to do 15 minutes of something really, really funny because when you laugh, your body reduces pain. When pain is accompanied by tears, your brain is going to intensify that pain and assume that your life is in jeopardy. If pain is accompanied by laughter, guess what happens? Your brain goes, maybe won't be so bad, and your brain will de escalate that pain. So, this is a great time for TikTok. It's a great time for YouTube. It's a great time for watching old movies. Anything that's funny and brings you laughter and love in your home. And that's what I wish for you right now. Please stay safe. Please stay home. Do not go out into crowds. And let's try to get through this together. All right. If you have any questions, you're always welcome to come on over to our website, icnetwork.org or ic-network.com. We do not have icnetwork.com. Somebody stole that from me 25 years ago. So icnetwork.org. And you can send me email. You can go through everything. And I'm just going to try to think of some other things to do. Also, if anybody likes to game, you like to play Fortnite, please send me an email because I'd love to put together an IC squad playing Fortnite together. I think we'd have a ball. All right. Okay, guys. See you later. You are not alone. We're going to get through this. Be well. All right, YouTube. Be well. Have a good one.